Question 1. A client is suspected of having a pulmonary embolism. What is the nurse's priority initial action? A. Administer anticoagulants. B. Place the client in high Fowler's position. C. Apply oxygen therapy. D. Encourage deep breathing exercises. Correct answer, C. Apply oxygen therapy. Rationale. Pulmonary embolism impairs oxygenation. The priority is to improve oxygen delivery immediately before other interventions. Question 2. A client suddenly develops dyspnea, chest pain, and tachycardia. What is the nurse's first action? A. Call the physician. B. Assess oxygen saturation. C. Administer morphine. D. Prepare for CT scan. Correct answer, B. Assess oxygen saturation. Rationale. Assessment comes first. Determining oxygenation status guides urgent interventions like oxygen therapy. Question 3. Which position is best for a client with acute pulmonary embolism? A. Supine. B. Trendelenburg. C. High Fowler's. D. Side lying. Correct answer, C. High Fowler's. Rationale. High Fowler's position promotes lung expansion and improves breathing in respiratory distress. Question 4. A client with PE is hypoxic. What is the nurse's priority intervention? A. Start 4 fluids. B. Administer oxygen. C. Give anticoagulants. D. Obtain blood samples. Correct answer, B. Administer oxygen. Rationale. Oxygen is the immediate priority to correct hypoxemia and prevent organ damage. Question 5. Which medication should the nurse anticipate administering first in a confirmed PE? A. Warfarin. B. Heparin. C. Aspirin. D. Clopidogrel. Correct answer, B. Heparin. Rationale. Heparin is the initial anticoagulant used to prevent further clot formation in acute PE. Question 6. A client with PE becomes hypotensive and confused. What is the nurse's priority action? A. Start ambulation. B. Increase 4 fluids. C. Elevate legs. D. Notify rapid response team. Correct answer, D. Notify rapid response team. Rationale. Signs of shock require immediate escalation for advanced life-saving interventions. Question 7. Which diagnostic test confirms pulmonary embolism? A. Chest X-ray. B. ECG. C. CT pulmonary angiography. D. ABG. Correct answer, C. CT pulmonary angiography. Rationale. CT pulmonary angiography is the gold standard for diagnosing PE. Question 8. A nurse is caring for a client on heparin for PE. Which lab value is most important to monitor? A. Hemoglobin. B. INR. C. APTT. D. Platelets. Correct answer, C. APTT. Rationale. APTT is used to monitor therapeutic levels of heparin. Question 9. What is the priority nursing action for a client with suspected PE and severe chest pain? A. Administer oxygen. B. Give NSAIDs. C. Encourage fluids. D. Apply heat. Correct answer, A. Administer oxygen. Rationale. Pain is secondary, oxygenation remains the priority. Question 10. A client with PE is receiving thrombolytics. What is the priority nursing assessment? A. Urine output. B. Signs of bleeding. C. Lung sounds. D. Blood pressure. Correct answer, B. Signs of bleeding. Rationale. Thrombolytics increase bleeding risk, which can be life-threatening. Question 11. Which finding indicates worsening PE? A. Decreased heart rate. B. Improved oxygen saturation. C. Sudden hypotension. D. Mild anxiety. Correct answer, C. Sudden hypotension. Rationale. Hypotension indicates massive PE and possible shock. Question 12. What is the priority goal in managing pulmonary embolism? A. Pain relief. B. Prevent infection. C. Restore perfusion and oxygenation. D. Promote mobility. Correct answer, C. Restore perfusion and oxygenation. Rationale. PE blocks blood flow, restoring circulation and oxygen is critical. Question 13. A client with PE is anxious and restless. What is the nurse's priority interpretation? A. Pain reaction. B. Hypoxia. C. Medication side effect. D. Fatigue. Correct answer, B. Hypoxia. Rationale. Restlessness and anxiety are early signs of hypoxia. Question 14. Which intervention helps prevent PE in high-risk patients? A. Bed rest. B. Fluid restriction. C. Early ambulation. D. Oxygen therapy. Correct answer, C. Early ambulation. Rationale. Movement prevents venous stasis, reducing clot formation. Question 15. A client with PE is on oxygen but saturation remains low. What is the next priority? A. Increase oxygen delivery. B. Stop oxygen. C. Give oral fluids. D. Encourage sleep. Correct answer, A. Increase oxygen delivery. Rationale. Escalation of oxygen therapy is needed if hypoxia persists. Question 16. A client with suspected PE has an oxygen saturation of 82%. What is the nurse's first action? A. Call the physician. B. Apply high-flow oxygen. C. Start 4 heparin. D. Prepare for CT scan. Correct answer, B. Apply high-flow oxygen. Rationale. Severe hypoxia requires immediate oxygen supplementation to prevent organ failure. Question 17. Which symptom is most indicative of a pulmonary embolism? A. Productive cough. B. Sudden dyspnea. C. Fever. D. Bradycardia. Correct answer, B. Sudden dyspnea. Rationale. Sudden onset dyspnea is the hallmark sign of PE. Question 18. A client is diagnosed with PE. What is the priority collaborative treatment? A. Antibiotics. B. Anticoagulation therapy. C. Bronchodilators. D. Steroids. Correct answer, B. Anticoagulation therapy. Rationale. Anticoagulants prevent clot extension and new clot formation. Question 19. Which finding requires immediate intervention in a PE patient? A. Mild tachycardia. B. Oxygen saturation of 95%. C. Hemoptysis. D. Respiratory rate of 10. Correct answer, D. Respiratory rate of 10. Rationale. Bradypnea indicates respiratory failure and requires urgent intervention. Question 20. A client with PE is receiving heparin. What is the antidote if bleeding occurs? A. Vitamin K. B. Protamine sulfate. C. Naloxone. D. Atropine. Correct answer, B. Protamine sulfate. Rationale. Protamine sulfate reverses the effects of heparin. Question 21. Which assessment finding suggests improvement in a client with PE? A. Increased anxiety. B. Oxygen saturation rising from 88% to 95%. C. Persistent chest pain. D. Tachycardia. Correct answer, B. Oxygen saturation rising from 88% to 95%. Rationale. Improved oxygenation indicates better pulmonary perfusion. Question 22. A client suddenly collapses with suspected massive PE. What is the nurse's first action? A. Check pulse and breathing. B. Administer heparin. C. Elevate legs. D. Start 4 fluids. Correct answer. Check pulse and breathing. Rationale. Follow ABCs, assess airway, breathing, and circulation first. Question 23. Which lab value is often elevated in pulmonary embolism? A. Hemoglobin. B. D-dimer. C. Sodium. D. Calcium. Correct answer, B. D-dimer. Rationale. D-dimer indicates clot breakdown and is elevated in thromboembolic events. Question 24. What is the priority nursing action before administering thrombolytics? A. Assess for pain. B. Check for bleeding risk. C. Monitor temperature. D. Encourage fluids. Correct answer, B. Check for bleeding risk. Rationale. Thrombolytics can cause severe bleeding, contraindications must be assessed. Question 25. Which condition is a major risk factor for PE? A. Hypertension. B. Immobility. C. Diabetes. D. Asthma. Correct answer, B. Immobility. Rationale. Immobility leads to venous stasis, increasing clot formation risk. Question 26. A nurse notes sudden chest pain and dyspnea in a post-op patient. What is the priority action? A. Administer analgesics. B. Notify healthcare provider. C. Apply oxygen. D. Encourage ambulation. Correct answer, C. Apply oxygen. Rationale. Oxygenation is the immediate priority in suspected PE. Question 27. Which ECG finding may be seen in PE? A. ST elevation. B. Atrial fibrillation. C. Sinus tachycardia. D. Heart block. Correct answer, C. Sinus tachycardia. Rationale. Sinus tachycardia is the most common ECG finding in PE. Question 28. A client with PE is receiving oxygen via nasal cannula but remains hypoxic. What is the next step? A. Remove oxygen. B. Switch to non-rebreather mask. C. Encourage fluids. D. Reduce activity. Correct answer, B. Switch to non-rebreather mask. Rationale. Escalating oxygen delivery improves oxygenation in severe hypoxia. Question 29. Which complication is most life-threatening in PE? A. Infection. B. Shock. C. Fever. D. Cough. Correct answer, B. Shock. Rationale. Massive PE can obstruct circulation, leading to cardiogenic shock. Question 30. A client with PE is restless and confused. What is the priority nursing interpretation? A. Pain. B. Hypoxia. C. Fatigue. D. Anxiety disorder. Correct answer, B. Hypoxia. Rationale. Neurological changes like confusion indicate inadequate oxygenation. Question 31. A client with PE reports sharp chest pain that worsens with breathing. What is the nurse's priority action? A. Administer oxygen. B. Give analgesics. C. Encourage coughing. D. Apply heat. Correct answer, A. Administer oxygen. Rationale. Pain is secondary, oxygenation is always the priority in PE management. Question 32. Which intervention is most important to prevent clot migration in PE? A. Encourage ambulation. B. Administer anticoagulants. C. Massage the legs. D. Apply compression only. Correct answer, B. Administer anticoagulants. Rationale. Anticoagulants prevent further clot propagation and embolization. Question 33. A nurse suspects PE in a client with sudden dyspnea. What is the first priority? A. Obtain ABG. B. Apply oxygen. C. Call the physician. D. Prepare medications. Correct answer, B. Apply oxygen. Rationale. Immediate oxygenation takes priority over diagnostics or notifications. Question 34. Which vital sign change is most concerning in PE? A. Mild fever. B. Tachycardia. C. Hypotension. D. Slight tachypnea. Correct answer, C. Hypotension. Rationale. Hypotension suggests massive PE and possible circulatory collapse. Question 35. A client is on warfarin for PE. Which lab value is monitored? A. APTT. B. INR. C. Platelets. D. Hemoglobin. Correct answer, B. INR. Rationale. INR is used to monitor the effectiveness of warfarin therapy. Question 36. Which nursing action is essential when caring for a client on anticoagulants? A. Encourage IM injections. B. Monitor for bleeding. C. Limit fluid intake. D. Promote bed rest. Correct answer, B. Monitor for bleeding. Rationale. Anticoagulants increase bleeding risk, monitoring is critical. Question 37. A client with PE has decreased level of consciousness. What is the priority? A. Assess airway. B. Administer anticoagulants. C. Check labs. D. Reposition client. Correct answer, A. Assess airway. Rationale. Airway always comes first in any deterioration, ABCs. Question 38. Which sign indicates a possible deep vein thrombosis leading to PE? A. Bilateral leg pain. B. Unilateral leg swelling. C. Arm numbness. D. Back pain. Correct answer, B. Unilateral leg swelling. Rationale. DVT often presents with one-sided leg swelling and can lead to PE. Question 39. A client with PE is receiving thrombolytics. Which finding requires stopping the infusion? A. Headache. B. Minor bruising. C. Hematuria. D. Mild anxiety. Correct answer, C. Hematuria. Rationale. Bleeding is a serious complication requiring immediate action. Question 40. What is the priority teaching for a client discharged after PE? A. Avoid all activity. B. Take anticoagulants as prescribed. C. Stop medications when feeling better. D. Limit fluid intake. Correct answer, B. Take anticoagulants as prescribed. Rationale. Adherence prevents recurrence of thromboembolism. Question 41. Which oxygen delivery device provides the highest oxygen concentration? A. Nasal cannula. B. Simple mask. C. Non-rebreather mask. D. Venturi mask. Correct answer, C. Non-rebreather mask. Rationale. Non-rebreather masks deliver the highest oxygen concentration without intubation. Question 42. A client with PE develops cyanosis. What is the nurse's priority action? A. Administer oxygen. B. Check temperature. C. Provide fluids. D. Reassure patient. Correct answer, A. Administer oxygen. Rationale. Cyanosis indicates severe hypoxia requiring immediate oxygenation. Question 43. Which assessment is most important after starting heparin therapy? A. Pain level. B. APTT level. C. Temperature. D. Respiratory rate. Correct answer, B. APTT level. Rationale. APTT ensures therapeutic anticoagulation and prevents complications. Question 44. A client with PE has a sudden drop in blood pressure. What is the priority? A. Encourage fluids orally. B. Administer 4 fluids. C. Ambulate patient. D. Delay treatment. Correct answer, B. Administer 4 fluids. Rationale. For fluids support circulation in hypotensive patients. Question 45. Which finding indicates effective treatment of PE? A. Persistent dyspnea. B. Improved oxygenation. C. Increased chest pain. D. Hypotension. Correct answer, B. Improved oxygenation. Rationale. Better oxygen levels show improved perfusion. Question 46. A client with PE is at risk for which complication? A. Stroke. B. Heart failure. C. Right ventricular failure. D. Kidney failure. Correct answer, C. Right ventricular failure. Rationale. PE increases pulmonary pressure, straining the right ventricle. Question 47. What is the priority action when a PE patient becomes tachypneic? A. Administer oxygen. B. Provide fluids. C. Give analgesics. D. Encourage rest. Correct answer, A. Administer oxygen. Rationale. Tachypnea signals respiratory distress and need for oxygen. Question 48. Which intervention reduces the risk of PE in hospitalized patients? A. Bed rest. B. Early ambulation. C. Fluid restriction. D. Oxygen therapy. Correct answer, B. Early ambulation. Rationale. Movement prevents venous stasis and clot formation. Question 49. A client on anticoagulants reports black stools. What is the nurse's priority action? A. Reassure the patient. B. Document findings. C. Notify healthcare provider. D. Encourage fluids. Correct answer, C. Notify healthcare provider. Rationale. Black stools indicate GI bleeding, a serious complication. Question 50. What is the overall priority in managing pulmonary embolism? A. Pain control. B. Prevent infection. C. Maintain oxygenation and perfusion. D. Promote rest. Correct answer, C. Maintain oxygenation and perfusion. Rationale. The ultimate goal is to restore oxygen delivery and circulation to vital organs. Thanks for watching. If you found this video helpful, don't forget to like, share, and subscribe for more content like this. Hit the notification bell so you never miss an update. See you in the next video.